people, and welcome to another video. Today I want to talk with you a little bit more about fibroids. And before we jump into this video, I want to take the opportunity to welcome all my new viewers to my channel. My name is Kat. I am a health blogger and wellness coach. I upload videos here on YouTube on a weekly basis that focus on women's health, anti-aging, and lifestyle. If that is something that you're into, please do subscribe and ring the notification bell so that way you do not miss any of the videos that I upload here on this channel. So let's go ahead and jump into this topic. When it concerns fibroids, as well as many other common women's health complications, there is a general lack of awareness regarding what fibroids are and what symptoms to look out for, which can lead to a lot of misdiagnosis, as well as women just not really knowing or understanding what's happening or what's going on with their bodies, and not having the proper knowledge can also contribute to women not reporting their symptoms or talking with their gynecologist or their doctor about what's going on with their bodies. A shocking truth regarding fibroids is that on average, 70 to 80% of women of childbearing age will develop an issue with fibroids. So today I wanted to share some basic information about what fibroids are and how they develop and what you should do if you suspect that you may have fibroids. So fibroids are defined as non-cancerous growths that develop within the uterus. They vary in size and can be small, microscopic fibroids that you can barely see, or they can grow and develop into large masses that can lead to and cause abdominal distension. It is also common for people that have fibroids to have more than one fibroid at a time. Now, when it comes to exactly what causes the growth or the onset of fibroids to develop, that is kind of a mystery, and it's kind of something that many doctors don't know why that happens or what causes them to grow and develop. But it is suspected that genetic changes within the body contributes to the growth and development of a fibroid. Additionally, female sex hormones, estrogen and progesterone, are thought to contribute to or encourage the growth of fibroids. There are 4 common types of fibroids, and depending on the location of the fibroid is going to determine its classification. The 3 most common types of fibroids are intramural, subserosal, and submucosal. And the 4th and most uncommon type of fibroid is the pedunculated. So with intramural fibroid growths, these tumors can grow within the uterus and have the ability to alter the shape of the uterus. Subserosal fibroids occur outside of the uterus and contribute to issues with heavy bleeding. Submucosal fibroid growths develop underneath the uterine lining and also contribute to changes and distortions in the shape of the uterus. And finally, in the case of pedunculated fibroid growths, they develop on a stalk outside of the uterus. And these different fibroid types can grow and develop within the body or within the uterus simultaneously. Signs and symptoms that can indicate that you may have an issue with fibroids include experiencing an abnormally heavy period flow that also has blood clots, painful periods with killer cramps or intense pelvic cramping, if you're experiencing a spotting or bleeding in between periods, having a prolonged period that lasts longer than 7 days, experiencing a feeling of pressure in your lower abdomen, having ongoing pelvic pain outside of your period. You may also notice that there is an increased need to urinate or that you urinate more frequently. And another feeling that may accompany that increased desire, increased need to urinate, is you may feel that you cannot completely or fully empty your bladder. It's also common for those that have fibroids to develop an issue with constipation. And you may also experience back pain, especially low back pain and leg pain. So what should you do if you suspect that you have fibroids, or if you identify with many of those symptoms that I just listed? Well, first things first, it's important that you schedule an appointment with your gynecologist to discuss what you're experiencing. And before you go into your appointment, you want to make sure that you compile a complete list of all of the symptoms that you've been experiencing, when these symptoms first began, how often these symptoms occur, and any other pertinent information that your doctor will need to know. During your appointment, it's also important that you're your own best advocate and you disclose and you discuss at length your complete menstrual history, your medical history, your sexual history, your reproductive history, just all of the information that you can give them, so that way they will have a complete picture of what is going on and they can make a more accurate diagnosis or determine what tests need to be conducted to reach an accurate diagnosis. You should expect to receive a pelvic exam from your doctor, as well as some type of imaging test, whether that is a CT scan, an ultrasound, or an MRI, so that way they can get a clear picture of what is going on in the pelvic cavity. And another important side note is, if you're in the process of trying to conceive, or you know that you want to conceive in the future, definitely speak with them about that and talk with them at length about your reproductive health and your fertility, and ask them as many questions as you can about what you're experiencing and how it's going to affect your fertility and when you anticipate starting your family. Make sure you ask all of these questions and you disclose that with them as well, because that can also help them to run specific tests and to dig a little bit deeper when it comes to safeguarding your fertility and getting to the bottom, or getting to the root cause of what is going on. So that is all for this video. I hope that you found this information helpful. If you did, give it a thumbs up and share it with a friend. Also, before you leave, make sure that you subscribe to this channel and ring the notification bell, so that way you do not miss any of the videos I upload here on this channel. And until next time, here is to defying aging and redefining health. Bye.